specifically didn't look at that, but that really isn't the issue here. So let me tell you what the issue is. There are several different ways of doing a hysterectomy when that's the required procedure. It could be done the traditional way, which is called a total abdominal hysterectomy. It's a 6-inch incision and a 6-week recovery time. Or it could be done laparoscopically, or the preferred approach, with the one with the least complications, the least blood loss, and the fastest recovery time, just a few days, is a vaginal hysterectomy.
We've always believed in respect for that patient-physician relationship, and we've been evolving this initiative that we're calling care coordination over the last 6 years. So for us, this is really the next natural step.
You've been in the industry for more than 20 years. For you, what do you think is the best approach when it comes to reform in healthcare?
I think that as a doctor and as a citizen, we have a moral obligation to make sure that as many Americans, all Americans, have access to health care. But I think the platforms are a little bit thin about what they're talking about. They're only talking about how we're going to finance health care.
We're talking about BPA and what are the safety concerns with this chemical, this plastic.
Well, let's talk about what the chemical is. It's actually an artificial estrogen that's in plastics, and it's also in the lining of cans. And especially when the plastic or any type of food heats up that BPA, it can leach out into the food or liquid that it's holding. So I really worry about the 70 million other people who are sleeping with people who just snore and don't have sleep apnea. Because as we've talked about in some other segments, not getting a good night's sleep can be associated with heart disease, a risk of diabetes, depression, marital issues, work productivity issues. I was really surprised at those headlines, actually. More importantly, though, it only found 78% of the people who had growths that were between 6 and 9 millimeters. And although those are less likely to turn into cancer, we don't know the rate of growth, we don't know the exact risk. So when you think about what test is right for you, is 78% potentially good enough? Are you going to sleep well at night?
This has a love purpose, shall we say, and you've compiled here a bunch of ingredients, things that will add to somebody's love life.
This was fun to put together. Love and sex have been shown to decrease the risk of a heart attack once again, and decrease overall life expectancy because of a hormone that's released that actually decreases your blood pressure. So these are all aphrodisiac foods. You're really walking on eggshells a little bit, but it's really important to recognize that as a parent, you are still the most influential person in your kid's life, and they really want you to be involved whether they admit it or not. So pay attention, and remember that even though they're over the age of 18, in most cases, you are not powerless, particularly if you are supporting them.
This is much bigger than financing care for 300 million Americans. It's really about, is the delivery system, doctors, nurses, and hospitals, are they efficient and effective in offering evidence-based medicine? And are our policies, our public policies and public health focused around promoting health as opposed to disease? We currently have a disease-focused healthcare system. We need a health-focused healthcare system.